Hi, and this is Emotion Stats, and I wanted to come on and talk about seizures. What are the causes of seizures? To help prevent someone when they're going or dealing with when they're going through or dealing with a seizure, I want this to be information for you to listen to, just in case, because as you know, some people, when they're little, they have seizures, and then you got some people, they might not get them until they're older. And it's strange because people don't know what it is, and they see what you're doing when you're having these seizures, and you could panic, especially if it's someone you care about or you're taking care of, you're in charge of them. Okay, so I wanted to read, and I'm going to the Wikipedia, and this is where I'm getting my information from as of now. So first I want to tell you, said there are many causes of seizures. The factors that lead to a seizure are often complex, and it may not be possible to determine what causes a particular seizure, what causes it to happen at a particular time, or how often seizures occur. It is also stated for under the diet, malnutrition, and overnutrition may increase the risk of seizures. Examples include the following. And now these are the bullet points I want to read to you. The first one is vitamin B1 deficiency. It is reported to cause seizures, especially in alcoholics. Now, the second bullet point is vitamin B6 depletion was reported to be associated with pyridoxine dependent seizures. The third bullet point states that vitamin B12 deficiency was reported to be the cause of seizures for adults and for infants. Folic acid in large amounts was considered to potentially counteract the anti-seizure effects of anti-epileptic drugs and increases the seizure frequency in some children. Although that concern is no longer held by epileptologists. Okay? Now, this is something serious, so you want to make sure that if you are receiving seizures, or if you are the person who knows someone who is having seizures, that you get the proper medical attention, prayer from your prayer groups at church. However, you need to do both. If you are in the church and you want to get prayer from your pastor or the people who are praying for you at the church. Now, also, I'm still in the Wikipedia, and it is stating that brain tumors are among many medical conditions in which seizures can be a symptom. Okay, so you want to watch out for that, because everybody wants to be in good health, and everybody wants to be able to understand, and they want to be able to handle the emotions that comes with dealing with this, because it could be scary, especially if you have children and you're at home and you're doing this. You need the proper care and attention, and you might even want to hire someone to help you, especially to come and check on you throughout the day, making phone calls to you to check on you to see if you are doing well. Okay, so however you do it, there might not be the same methods that people use to take care of this, but whichever one you choose should be correct and helpful for you or that person that you know that's dealing with this. Okay. Now, those with various medical conditions may suffer seizures as one of their symptoms too. Now, these can include, and I'm going to name these bullet points because it's a number of them. And they, of course, if you go in here and look in the Wikipedia, you will be able to find the same information that I am reading to you. And they're reading these in order, in alphabetical order. So I want to start and tell you, I'm not going to read them to you in alphabetical order, but you're going to hear them. I'm going to go the opposite way. Hold on. Okay, the first one is tuberous sclerosis. Then you have another one that's systemic lupus.
Erythematosus.
Erythematosus.
Erythematosis.
Multiple sclerosis, meningitis, Fragile X syndrome, encephalitis, epilepsy, eclampsia, Down syndrome, cerebral palsy, cavernoma, brain tumor, brain abscess, arteriovenous malformation, and Angelman syndrome. Okay, so other conditions have been associated with lower seizure thresholds and or increased likelihood of seizure comorbidity, but not necessarily with seizure induction. Examples include depression, psychosis, obsessive compulsive disorder, OCD, attention deficit hyperactivity disorder, which is the ADHD, and autism, among many others. Okay, so of course they have something that they can prescribe for you for this. If you're going to see a medical doctor, you can go in and get information on the medicines, the prescriptions that they would give for this. Okay, so I want to talk about stress. Many of us should know what stress is at this time. But at this time, if you don't know what stress is, I want to talk a little bit about stress. And I'm going to go to a dictionary to get this information. Okay. Stress is number one, pressure or tension exerted on a material object. Okay. So, number two is a state of mental or emotional strain or tension resulting from adverse or very demanding circumstances. These things can cause stress. And stress is just as serious also as having a seizure. Okay? If you're subject to pressure or tension, you have the likelihood to have stress, seizures. When having stress, you could become tense or anxious and worried. So, what they're saying here is what can cause your stress is your circumstances. What are your circumstances? What's going on with you? Are you backed up? Are you moving in a different direction than you thought you would? That can cause stress on you. Okay, and there's many things, of course, that can cause stress on you. Tension, worry, and anxiety, nervousness, trouble, difficulty, distress, trauma, suffering, pain, grief, and hassle. The opposite of stress is relaxation. Okay. Which, if you are in a stressful mood, you want to have relaxation. That's what you want. And it's certainly what you need. You may be needing that. So So, stress can induce seizures in people with epilepsy and is a risk factor for developing epilepsy. Severity, duration, and time at which stress occurs during development all contribute to frequency and susceptibility to developing epilepsy. It is one of the most frequently self reported triggers in patients with epilepsy. Stress exposure results in hormone release that mediates its effects in the brain. These hormones act on both excitatory and inhibitory neural synapses, resulting in hyperexcitability of neurons in the brain. The hippocampus is known to be a region that is highly sensitive to stress and prone to seizures. This is where mediators of stress interact with their target receptors to produce effects. Epileptic fits as a result of stress are common in literature and frequently appear in Elizabethan texts, where they are referred to as the falling sickness. Now, a breakthrough seizure is an epileptic seizure that occurs despite the use of anticonvulsants that have otherwise successfully prevented seizures in the patient. Breakthrough seizures may be more dangerous than non-breakthrough seizures because they are unexpected by the patient, who may have considered themselves free from seizures and therefore not take any precautions. Breakthrough seizures are more likely with a number of triggers. Often, when a breakthrough seizure occurs in a person whose seizures have always been well controlled, there is a new underlying cause to the seizure. Breakthrough seizures vary. Studies have shown the rates of breakthrough seizures ranging from 11 to 37%. Treatment involves measuring the level of the anticonvulsant in the patient's system and may include increasing the dosage of the existing medication, adding another medication to the existing one, or altogether switching medications. A person with a breakthrough seizure may require hospitalization for observation, okay? So remember, if you are in the church, you need to go there for prayer, take your prescriptions, and see a doctor regularly. You go to the doctor, make sure you don't panic. Practice not panicking because you can't control this situation when it comes. So you want to be as calm as you can be, okay? So just put that in your mind for your emotions so you can be calm, because when you're calm, you'll be able to help the other person as well deal with their illness or the seizure that they're dealing with. Okay. And also, it's good if you all can let the people in your families know, your friends know, if this is an ongoing thing and they're receiving seizures so that they get help.